Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. Alright Kelly, so today it's about 2 months follow-up
Yes.
from your first treatment.
Yes.
So can you give me an update? Let's go over your history a little bit, your condition before I start, we had the first session.
Okay. I had very strong pain in my neck and in my lower back, but mostly my neck between my shoulder blades.
Okay,
My range of motion was extremely limited,
okay,
and just constant pain, throbbing pain, sharp pain, dull pain, ache, just constant. It was there all the time, no matter what I did.
How long do you were experiencing pain for?
I was in a car accident about 8 years ago, and ever
Okay.
since then,
So
off and
for
on.
8 years
Yes.
on and off,
Mhm.
you've been experienced that.
Yes.
And during those 8 years, have you had previous treatment?
Yes, I went to physical
Okay.
therapy, which would give me some relief, but it
Mhm.
was very temporary relief.
Okay.
I did injections in my lower back. I forget what they're called.
Yeah, epidural or cortisone?
Cortisone.
Okay.
And again, it was a very temporary fix. It
Okay.
never took away my pain completely.
Mm-hmm.
And I just struggled between,
Okay.
back and forth with therapy, doing stretching,
Mm-hmm.
very limited to what I could do as far as exercise or
Mhm.
even activity,
Okay.
because I always had pain.
So how many ASTR treatments you received?
2 ASTR treatments.
2 ASTR treatments.
Yes.
And that 2 ASTR treatment was actually 2 months ago.
Yes.
So can you give us a feedback? What did you feel after the first and the second two And is your pain came back or it's totally gone after
My
the 2
yes.
treatments?
Yes. After my first treatment, my range of motion was the first thing I noticed.
Mhm.
I could actually move my neck completely from side to side and back and forth. I still had a little bit of pain after the first, but it was nothing compared to what I had been having and enduring. And after my second treatment, the pain in maybe 3 days after that treatment was completely gone.
So you had the third visit and we did
Yes.
nutrition.
Yes.
Can you give us an idea how the nutrition helped you and what was your symptoms before doing the nutrition and what currently experiencing now?
Lethargic, not
Okay.
a lot of energy, before we did
The nutrition
yes.
evaluation and
Yes.
Mhm.
And just really made me stop and think about what I was eating and doing.
Okay.
The vitamins and all the supplements I were taking were not, as
Doing-
good for me as I
Okay.
thought they were,
Mhm.
between the fillers or the chemicals or the things that are in them that just weren't good for me.
Okay.
Um,
So you were feeling fatigued and
I
tired.
was feeling fatigued and tired.
For how
and
long
yes.
you been experiencing that?
Oh man. Well, when you have constant pain, it's almost like a daily.
Daily thing.
Daily
It was
thing.
like around the same time when you had
Yes.
your neck and back, like
Yes.
8 years.
Yes, because it would be
Okay.
wearing to
Mhm.
wake up and be in pain and continue about your day or work. And by the end of the day, I would be exhausted.
Okay.
I just would have no
Mhm.
energy for anything.
So we had one nutrition evaluation and I
Yes.
give you the treatment plan with the
Yes.
diet and the supplements that
Yes.
your body needs. So can you give me an update after you getting to the diet and the supplements, what you currently feel?
I feel just energized. I
Okay.
have more energy.
Mhm.
I'm not so lethargic.
Okay.
I was having issues, with my hair thinning and starting to fall out. That's stopped.
Okay.
I think my skin looks better. I just feel better.
That's good.
I feel lighter. I
Okay.
just feel happier.
That's beautiful.
I
yeah.
just feel
You back
better.
to normal, like
Yes.
your normal life. You feel
Yes.
you're not restricted with
No.
your daily activity.
No.
You're not like tired
No.
in the middle of the
No.
day.
I
That's
feel
beautiful.
like I can have a life again because
nice,
I
yeah.
wake up not in any pain
Mhm.
and with energy and excited.
Mhm.
and not dreading, you know, the things I have to do today or
That's awesome.
do. So
Yeah.
and I can't thank you
You're
enough.
welcome.
I can't
Yeah.
thank you.
I'm
And
glad.
before I came to see you, before that first treatment, I had undergone physical therapy again,
Mm-hmm.
and it made me feel worse. I was actually in
Oh,
more
sorry.
pain after a week of doing physical therapy,
Wow.
and that just didn't work for me. It just wasn't the answer.
Mm-hmm.
But this certainly was, and I just I can't thank you enough
Oh, you're
for how
welcome.
good
Yeah,
I
I'm glad
feel,
you're feeling better.
and that the pain is gone,
Yeah.
because this is the first time in
Yeah.
a very long time
Yeah.
that I can wake up and not have constant pain or be in pain.
Mm-hmm. Glad you're
So-
feeling better.
Yes.
So what would you say to a patient that looking for ASTR treatment for pain or fatigue? What would you say to them?
I would tell them to definitely try it. Definitely try it, especially if they've gone the physical therapy route or injections route.
Mm-hmm.
Definitely try the ASTR. It will give you relief. It will help you.
Mm-hmm.
And the supplements and the diet are just like a cherry on this top of the sundae. It
Yeah.
goes together,
Mm-hmm.
but it works,
Mhm.
and it will make you feel incredibly different. You will feel better,
That's nice.
energized,
Mhm.
happy.
So what would you say to healthcare provider like physical therapy, chiropractor about different than their current approach? What would you recommend to them?
Stay away. Stay
No, they
away
can take
from
the
that.
ASTR class and
They
do
should.
that.
They really,
Yeah.
really should.
Yeah.
It's just such a different approach what you do.
Yeah.
And it's so amazing the relief
Mm-hmm.
that you get from the treatments. It
Mhm.
truly is. I mean, when I came to see you, I was kind of at the end of my rope. I really
Oh.
didn't know what else to do, because I had been to physical therapy and it just didn't help. And I didn't want to have surgery, but I didn't
Mm-hmm.
know what I was going to do. So I am very, very happy that I came to see you. And if anyone's even considering it, or if they've had neck pain or back pain their life, they shouldn't even hesitate. Just please come and get a treatment and see for yourself
Mm-hmm.
the difference it will make, because it truly, truly will make a difference for you.
All right. Awesome. Thank you so much.
Thank you, Doctor.
Subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!